Hey, good morning, Guam. Welcome to the Canada Buzz, and this segment we call For the Record. For the Record, right here at Isla 63, your Chamorro radio station. We're bringing it to you, of course, as a part of D14 right here on KUAM's effort to educate our public. This morning, of course, we have the gubernatorial teams of Gubernatorial representing Gubernatorial, of course, is here this morning, as well as the Gubernatorial team. We'll be talking this morning about healthcare. Concentration this morning, again, is on healthcare from the gubernatorial teams of the Republican and the Democrat. Of course, on the Gubernatorial side, we have the administrator and director of Department of Public Health and Social Services, Jim Gillian, this morning. And of course, representing the Gubernatorial, none other than Vice Speaker B.J. Cruz. Good morning, gentlemen, Senator, Director. How are you doing this morning?
Great, thank you.
Let's go. Thank you very much again for taking time out of your busy schedule to be with us this morning to discuss issues pertaining again to healthcare here on our island, as the point of view or the issues of platform issues from both gubernatorial candidates. Who wants to start out? Mr. Gillian?
Sure.
Okay.
Ask your questions.
Just ask the question.
Okay, let's go ahead and do it. Mr. Gillian, you've been in director now of Department of Public Health Social Services for 4 years, almost a complete term of over 3 years. Okay, the Gubernatorial. What have they done holistically in healthcare to accomplish in this past 3 years near term, or now going on 4 years for this administration, accomplished in healthcare holistically? And I'm not just talking about your entity of public health, but also the Guam Memorial Hospital and what is known now as, I guess, behavioral wellness, formerly mental health.
Yeah. Okay, Jess, I'd like to be able to try to do the holistic approach, but you know, I'll
give you a minute, but if you go over that, yeah. I'll give that overtime.
Sure. I know public health more so than any. And actually, Brian St. Nicholas was supposed to be here, the senior advisor, and he has a broader overview. But I think what I see mostly is the Gubernatorial administration supporting all of these entities to the maximum extent they can. And I think the thing that really I find really enlightening and uplifting is that they let us do our job. Okay, they take us as the expert. They listen to us. They give us the support as much as they can. And you know, we had some difficult beginnings, but I think you know, the availability of more revenues being made to us, we're doing a much better job. We had, again, like I said, we had a difficult start, especially in staffing a lot of our programs.
Okay. Is that it? Okay.
Right now.
Okay. BJ, call you BJ. Just call
Please,
you
BJ. No, that's been my name for
a long time,
many years.
Okay. Going back, okay, go back to the record. 94 was the first time. I mean, there was a caller yesterday that said this would be Guterres' third term. I said, not that I know of. Or, you know, he ran 3 times. The only time I knew he got elected was 1984 and 1998, 2 consecutive terms. The 8 years, what did Carl Guterres or the administration, Carl Guterres administration, accomplish in those 8 years in regards to healthcare holistically?
Well, I mean, during that period, unfortunately, they didn't have all the assistance that you have now. I mean, James in Public Health and Social Services has the advantage that the Medicare assistance has gone up. There's a recent appropriation for, or at least an authorization from the federal government for $260 million.
278.
$278 million, which they've done an excellent job of using that money for matching, and we moved a lot of the MIP people over into the federal Medicare system. Back in the 90s and in the early 2000s, you barely had $16,000. I mean, $16 million a year to be able to operate.
Can you speak louder for our radio listeners?
And now, this last year, you've run up almost what, $71 million in MIP and Medicaid.
At the end of this fiscal period, it's going to be for Medicaid alone about $81 million. That's net.
Mm.
Okay.
And so, I mean, that's a huge sum of money, and any administration that would have that kind of money could be able to provide all kinds of assistance to the departments. Unfortunately, even with that kind of money, the $81 million, it's impossible to try to fund the hospital.
Mm-hmm.
And that problem has been persistent since time immemorial, you know, and when he was at GMHP, and now it's just an issue of trying to, what meager resources you have in government, to be able to address all these issues. And I know this morning I was just reviewing the documents that Mr. Verga sent to the committee about the fact that that they have a balanced budget at the hospital. But the balanced budget they keep claiming as revenue amounts that they keep billing public health and social services, and public health and social services is saying, you know, you can bill us for $61 million, but we're only going to be able to pay you $35 or $36 million because that's all that we can justify in the billing. The hospital is saying they're reporting $60-some million in receipts, but that's not receipts because they're not getting that amount from
public
them.
health,
And
yeah.
so that budget is not balanced, and there's got to be some time to be able to address that. Public health and GMH keeps insisting there's got to be a redefinition of what can or should be done. I'm not sure if that's Jim's responsibility. You used to be the Health Planning Council.
Yes. Mm-hmm.
And
the
you
vice
guys-
chair
yeah.
of the Committee on Health, yeah.
Yeah, the Health Planning Council, and that council had the authority to revise
Sure.
these kinds of things. I'm not sure whether or not the administration has addressed that, and the hospital wants it addressed. I'm not sure Public Health and Social Services wants it addressed, because I mean, if you increase that, then the amount that they're having to pay, the $81 million that they're paying right now, may mean they're going to have to pay $100 and some million next year, and the amount of money from the federal government is quickly being depleted. And my concern is that I haven't heard or known that we've actually accepted the new Medicaid program, the enhanced. And so I keep trying to figure out how can we be tapping that $278 million when we've not agreed that we're going to go to this expanded Medicaid. You know, it's all these kinds of things, and it's just an issue of money.
Yeah. Well, let me ask you the issue of money, and of course there are issues here where we're talking about whether or not they have issues with. This is what public health is supposed to be giving us, and whether or not public health has reimbursed them that for that amount. That again, it's a money issue. But how do we resolve this? What in the next 4 years, this previous, of course, coming up on 4. How do we resolve this issue then? What is the Gubernatorial team going to do to resolve this issue? Because when people talk about socialized medicine and all that, I mean, really, Guam is socialized medicine. when we look at, you can't turn people away from public health, you can't turn people away from GMH. So we have socialized medicine without the funding to fund socialized medicine. We don't have that. Other places that have that, it's a funding that comes from the taxpayers. And in this sense, we have taxpayers, but we're not funding socialized medicine, which we already have at this point.
Well, I think one of the problems really is the resource that's available to pay for the care never can be controlled. Okay, the amount of money that's available to pay for health care will rise to the amount that's available. I mean, if I have $278 million and I'm able to match all of that this year, it will all get spent this year.
Sure.
It's just the way.
Whatever that matches,
even
you're
Medicaid,
going to use it all. Yeah,
CMS
sure.
does the same thing. They continue to incur more expense and more costs. Okay, and I think that the direction is the wrong direction. What we try to do is squeeze down and control the cost of care by limiting the amount of reimbursement. Now, a savvy physician says, okay, I used to get X amount of dollars for doing one procedure. Now I need to do two procedures to get the same. So
thing.
they'll do it.
They'll do that, yeah.
Okay, and there's really nothing wrong with it. They're practicing quality medicine. It's all necessary. But there has to be another approach, and there also has to be a really definite continuing source of funds for healthcare. And you know, I know Joe Verga talked about a departure fee, you know, at the airport,
Which can't be
which we can't because that's a congressional.
You were
It's
airport,
also-
you know that.
Yeah,
When I heard that, I said,
No, it's also a congressional privilege. You can't do it.
I wish I was a legislature.
But you know, I mean, it's attractive
Sure.
for you know, right off without any research. You say, yeah, you know, people want to go home, so they would be willing to pay. You do it when you leave the Philippines and other countries. So we do need to get a little bit more creative. And I know the Kabul administration is looking at different kinds of avenues to find other resources to pay for care. Like Senator Cruz said, we have this new population, which is adults without children, which will now made part of this expanded Medicare program, and that's basically what the $278 million carrot was for. Okay, and even the federal participation, okay, in that, as far as the matching goes, is much better than our overall, which is about 43% local and 57% federal. But all of the other programs that we have, traditional Medicare and our children's program, EPSTD, those are all capped. So it doesn't matter if you incur anything over that, we pay 100% of that. In other states, it's open-ended, and of course the matching is a lot more generous. I think if I look at Mississippi, I think they're almost like 25% local and 75% federal.
Yeah.
Okay, and their per capita income is higher than ours. But that's a congressional thing. Okay, we can't do much about that. CMS can't do much about that. The Congress has to authorize a different funding source. The Affordable Care Act somehow managed to get this new population in at a significant federal participation rate, but that's only going to last till 2019.
Sure.
And even that $278 million, which we have been spending into, obviously we're spending $81 million this year. Okay, when we used to spend only about 50. So it's being spent, but come 2019, and I mean January 1st, 2019, that money is, if it's not used, it's gone.
Yeah. So BJ, again, I'll ask you the same question. What remedy do the Gutierrez Gumataltal team have to tackle the same situation? A money thing.
Well, it's something that nobody wants to talk about, but I know I'm not speaking for them on that issue, on how you address that. No, because there's no way. When you were chair of health,
Sure.
you understood that the amount of money that we gave to public health for a total of paying the hospital was at that point only 40. Jim remembers it when it was 50, and it's still not sufficient. And now it's going up to 81. Unless Congress increases or removes the matching and provides us 100% reimbursement, we won't be able to address that. That has to be done by the administration, whichever the administration is. And I know they've been trying to do it, and I know Madeline has been trying to do it, and a Democratic governor will try to do it with President Obama, and we'll work with it in Hillary's administration in 2016. So it'd be great to have a Democrat in there to be able to work with them. You're playing this political game. I'll play with you on it. You were the one that started that.
And we're going to get war reparations too, right? Yeah, I heard about that as well, right? Anyway, but let's go to this because shortly here. I mean, I think it's the end of the year. If it's not pushed back to the beginning of the year, the new hospital, the Guam Regional Medical Center, is going to be opening up. It looks like, I guess what people are saying, that the haves, the people that can pay, the people that they have insurance will be able to go there, and it's going to look like maybe the ones that don't are going to go to GMH, and it's going to compound. I mean, that situation at GMH is going to compound the problems over there. How do we resolve that? I mean, it's a great thing that we have another hospital. I mean, I love that we do, but the problem at GMH, not necessarily because you have another hospital, but people who may, again, as Glory Long said the other day, we are a profit-making hospital. We want to get paid. We'll work with you, but we still want to get paid. So the philosophies are different. One is a profitable entity, one is necessary or not. But how are we going to resolve the problem? It's only going to get worse.
Well, the only way that you're going to be able to do that is the taxpayers are going to have to pay for it, and the benefits that are provided. I know Jim's been very diligent in addressing the issue of exactly how much what is being provided. I mean, I was shocked last year when I found out that we went in, $31 million in renal care.
Mm-hmm.
We've got to start addressing preventative health care,
Thank you.
because the amount, there's never going to, regardless of which administration you have, they're never going to be able to tax the taxpayer enough or get enough from the federal government to be able to pay that. And then now, I mean, even with the new health insurance, we've now added on as a benefit organ transplants. I don't know if you know how much those things cost.
It's cheaper in the Philippines, but it's still a lot of money.
It's still hundreds of thousands of dollars, and that's that increase,
Sure.
And so, if I know I've had discussions with Jim. Yes, I would love to do this, except for the fact that the cost is going to be prohibitive to add this kind of thing as preventative. But we've got to start doing more preventative stuff, because no administration, regardless, is going to be able to control that.
I completely understand that. Believe me, and I'm a proponent for that as well. I see the numbers constantly rising, and we want to put some of these businesses out of business, But the fact remains is that, and the more we have, I guess maybe they're investors in fast food entities as well when they come out here. But let me.
Well, I mean, if you really want to know, I mean, the one thing that I will encourage Governor Gutierrez to do when the first thing he comes in is that they've got to finally realize that Guam Memorial Hospital is and should be the most important department in the government, and they should get someone like Jim to run Guam Memorial Hospital.
Please
No, but but to have an administrator, it cannot be someone who does not understand the
He's
system.
offering you a job.
We've gone through that in the past, where it's been a political accommodation for someone who we couldn't place anywhere else in government, has become the administrator of the hospital.
Sure.
And that has to be a top priority. The best administrator possible, if this administration or next administration, that is the person that should go to the hospital, because that has to be put under control. You cannot be saying that your revenues are your receipts, and that you can claim that you're going to make $144 million next year when you only collected 69 last year, and if you're lucky you'll get 71 this year. How are you going to double that?
Well,
because those are not what you bill and what you're going to collect. You've got to be realistic about it, and that's how you get the balanced budget. It's going to be unbalanced if you continue to do this, where you say, well, my property taxes should be much higher, so I'm going to jack it up. No, your formula for property tax is a certain percentage times the appraised value. Unless you change that percentage, it's not that amount isn't going to go up. So quit saying you're going to get more money and jack up your budget. We didn't do it in our budget, and neither should the hospital, because until someone, whether it's the federal government, increases the matching or agrees to start paying 100% of the billing that they send Jim, you will never be able to make your quote-unquote revenue or your claimed receipts be equal to the $144 million.
Okay. Can I get the same amount of time?
Sure.
No, let me, the thing about this, though, is I think that, indirectly is saying this hospital administration is not up to snuff, and that's not true. I think Joe Verga is very conscientious, very experienced gentleman. He's inherited a situation that's impossible. If you would have asked me to take that job right now, I'd say absolutely no. Okay, it's just almost impossible. The way it's set up. Okay, unless certain things start to happen, some more autonomy in terms of what the administrator can do. It's going to be a large problem. The fact that they inherited systems that don't work very well, and although Senator Cruz did find money for them to put in a new billing system, they're looking at another one. If that gets corrected, there's going to be significant improvement, at least in the quality of the billing. But he's right. the gross billing is never going to be collected. In any situation, it's never collected. I remember Doris Brooks being quoted saying something like they only collect 70% of what they bill from MIP and Medicaid. That's a pretty good percentage. A lot of hospitals in the States don't collect that much. Where our big problems are the people who are not paying at all. Okay, and we're still trying to figure it out because we know that Medicaid covers about 42,000 people. Okay, MIP covers another 17. Okay, and we pay, again, reduced fees, but we pay at about 70% of what they're billing us. We don't know what happens with the rest of that population who's not paying. We still are not able to define who they are or find them. And if they're people who should be in our system somehow, we have to get them in the system so at least the hospital doesn't lose that revenue. I have to believe that there are people who just don't pay their bills, and we don't have the wherewithal, at least the hospital doesn't. And even though the governor's committed to collecting every dime, the cost to put that in place, if it's going to cost you $5 to collect $3, doesn't make any sense.
Well, and that's the thing. We go back to this. I mean, because we, as much as we're not going to admit that we have socialized medicine here, we do have it because we can't turn anybody away, and we have a system then that's set up. And you offered him a job already, but he's going to come into the same system.
But I want to go back.
Same system that we have, and you're going to be asking for his resignation.
Well, no, but the thing is that at some point, someone has to address how much of what the hospital bills can and should be paid by public health and social services.
Sure.
And I don't know who that is. I know at one point when you were health planning council that you guys made that determination. And so Jim and I have spoken about this in the past of is there going to be someone who's going to review that? And also, I know that the current administration of the hospital is trying to work with CMS to try to bring back and revisit all kinds of old buildings to try to figure out if there's a way of increasing that amount. But until that's done,
so
no one's
Jim,
going to be able to do that.
The collaboration then, okay, because is there collaboration, is good collaboration between public health and GMH in regards to payment, what is owed, and where is that line that can be budged?
Well, we still have some differences about what they say are receivables and
Okay.
what we say are payables.
Okay.
So we're still working on that reconciliation, and some of those bills are old and they're time limited.
Okay.
We won't be able to pay those.
Okay.
CMS won't allow us to pay.
Okay.
So we really have to define all of that. And I think one of the problems they have is they have dirty billing. It's really messed up. Sometimes bills get returned to them because they're billing for X procedure, but on the record it shows a different procedure. So that stuff, that stuff needs to get cleaned up, and that's a very tedious process.
Yeah.
Okay. And I wish we could just not do that and do a prospective payment or some other kind of arrangement. But CMS is very kind of strict about how things get done.
But aren't there the collaboration again and on what you would accept and what's easier for you again to be able to submit?
Of course.
And is that being done? And if it has to be done in a different level, can we take it to the level and make sure that happens so we can, as you said, there are a lot of these past billings that no longer CMS won't be able to reimburse us for. Right. So that's lost. That's gone. So moving forward, how do we make it easier? How do we collaborate and what form of billing or numbering system, whatever it may be, that's accepted that you can very easy to detect or you can dispute whatever is should be disputed, but then it's in enough time to be able to submit for reimbursement.
Yeah. Well, I think their billings are fairly timely. Okay, they're within about 45 days.
Okay.
I think where they have problems again, and not being there. Okay, it's just anecdotal. Physicians are not finishing their records on a timely manner. I mean, the time between a discharge and the completion of a medical record, I think, is like 53 days. So the billing.
No, I mean, can we get in the physicians? I mean,
well,
can we penalize them for something?
Well, basically, if they're not up to their what they're required to do, they're not allowed. Their privileges are suspended. Okay. But when you have only one or two surgeons, or something, other specialties, and they're not doing it, you still need them to do surgery. So it's very difficult. I think, and I wanted to get back to the private hospital. I think one of the lights of this is that they're bringing in more physicians.
Okay.
The more physicians you have, okay, better access,
Sure.
better acceptability, and these are all quality docs.
And they'll
Some
be
of
able
them
to
are
practice in
local.
both hospitals. Yeah,
They'll be able to
they're-
practice,
yeah.
hopefully,
Yeah,
in both
yeah, sure.
hospitals. But the fact that there will be more providers
Mhm.
generally has also an effect on the reimbursements,
Sure.
because there are doctors looking for work. Right
Mhm,
now,
mhm.
doctors are as busy as they want to be, and they're making, you know, a fairly decent living. So there's no incentive for them to do any extra or to pay attention to the rules.
Mhm.
I'm not saying that's all, but it happens sometimes. But you know, this is a good thing, and I think the fact that the regional medical center or medical city, I'm sorry, has decided to even participate in our clinics at Northern Health Center.
Mhm.
Okay, again, expands our capacity. We take pressure off the emergency room because there'll be more providers at
Mhm.
the Northern Regional
Sure.
Health Center.
Mhm.
You know, so those are all good things that can happen from the hospital, at the new hospital. And I think that they have committed to providing care regardless of ability to
Sure.
pay. Isn't that in their charter?
Well-
Now, again, it remains to be seen.
Sure.
Because yeah,
Mhm.
Gloria's right. She
Mhm.
has to make money, okay, and you can, and you can still provide
Well,
some amount of
they won't be
uncompensated
able
care.
to. I mean, they won't turn away emergency.
Yeah. And they really are up against it this
Sure,
first year, because
sure.
they won't participate in Medicaid or MIP because they need to have at least a
Sure.
1-year track record
Sure,
before
sure.
they can even do a cost report.
Sure.
So they're not looking at us as a way to give them any funding, at least for a year. But I want to say that, you know, that there have been some positive things at the hospital, been some very positive things at mental health, and I think it's because, again, Governor Cobbles lets the people who run those agencies have their way, and I think you'll see that in behavioral health, a lot of our suicide prevention programs, our tobacco cessation programs, all of the alcohol addiction, all these
Mhm.
have increased participation in the community. We have a lot of young people now getting involved in things through the
Mhm.
incentives that are provided through the mental health, behavioral health and wellness. I'm sorry, you know, are still really pushing a lot of community involvement. Our non-communicable disease consortia, several of those have gotten more community awareness.
Mhm.
All of that is a result of the governor saying, you do what you think is right. Okay, you push and you decide. Okay, and just let me kind of know what's going on once in a while. And he's been very
Mhm.
good about that. And as the lieutenant governor also, they've been very supportive of public health, mental health, and obviously the hospital, because when it's time for payday, they're the first ones in line. Okay, they get paid. Okay, that's one thing that
Mhm.
we've seen now, sometimes to the detriment of our outside providers, but
Yeah.
he has been
Mhm.
committed. I mean, there are a lot of people who have made some comments about whether he has something to do with the new hospital, and he's been 100% behind GMH, and if he can find additional funding, he'll find it. And I know that Senator Cruz has asked me many times at hearings, do you have enough money? And my answer to him has always been, it's all I have.
Mhm.
Okay.
Senator Cruz, let me ask you this. When Carl Gutierrez was the governor, at one point he took control of of GMH, full control of GMH. What resulted in that takeover, basically?
Well, it was a very difficult time. It was right at the very end, and yeah, I mean, we had the typhoon and that blew up the hospital. But the thing is that it's that kind of leadership that you need. You cannot just be hands off and let the board do what it's going to do and the hospital, because as Jim was talking about, yes, I agree, the hospital needs to be doing things, but when you talk about the doctors being 53 days late in their billing, the hospital has to invest in recording devices or in the dictation machines. As I understand it, there's only 2 dictating services that they have. If you know that's going to be the basis of your billing, get 10 so that you can get it out in 5 days as opposed to 4. When I've been all over them about the fact that it's coding. Coding is important for your billing. It took them years to do it. I mean, now they're doing it with strange POs, but I said, I congratulate you for at least doing the billing, but you have to comply with procurement. And so they're trying to address it, but they need to address it correctly, and they've got to address it in a timely fashion. The billing problem, at the very beginning of this administration, there was a RFP for a collection agency. Today, they still don't have a collection agency on because they haven't finished the contract. The contract that was almost signed in February of 2011 was finally outright rejected. They had to rebid it, and they're still now negotiating it, and they don't have a collection
Well,
agency.
I
and so it's
I don't know if collection agency is going to work. I mean,
No, I understand, but
when
I
I was
just-
the vice chair, there was a collection agency that was put in there, and it was terminated because, I mean, their collections, we questioned the collections and what was reimbursed in the hospital because it didn't work. But do you, Jim, do you agree that the governor, whoever may be, should step in and take full control then? I mean, because he already does basically in a sense, but basically firing an administrator and go in there and
Not
do
like
that.
Governor Gutierrez did. No, we're not going to dissolve the board and just run
yeah.
the hospital. I think that, you know, people who either are committed, know something about running a hospital have to do that. Okay, not a governor who has so many other things to deal with. We have to also remember that this current board selected Joe Verga. He's not just somebody that got dumped over there. Okay, and Joe Verga is really good at what he does. Okay, he's a very conscientious guy. He maybe a little bit more blunt than people like, but you know that's his style. We're talking about also, you know, what has this administration done for other agencies? You know that our behavioral health and wellness facility has been off the federal receivership and now is, you know, on their own doing their thing. So there's, you know, been a lot of positive accomplishments. There are still some challenges, and that's why they're they're going forward, looking at the next 4 years, okay, making sure that the good things that we built the foundation on, okay, now gain some fruition, because we really have overcome a lot of challenges. When I came into public health, was it March or April, okay, over the course of about 9 years, they've lost 50% of their staffing. Okay. Still had the same unfunded mandates, still had all of the things that they needed to do with much less staffing. We've gotten as much support as the governor can afford in terms of staffing. We brought in $13 million just in the past 2 years in grants for services for children from 0 to 5 and 0 to 8 years old. Those are expansion grants that are going to bring in at 100%. That should bring in more services to our children who are at risk. These are all programs that probably would not have happened if our folks hadn't been there, if our if our Colville team hadn't been there.
Yeah, but also in behavioral wellness, I mean, remember a couple of years ago when I was up there, when it was still Department of Mental Health and Substance Abuse, and talking about rehab. Yes, there's educational programs, but there isn't an in-house rehabilitation system. As I said to one of the psychiatrists, you know, your name is DHMSA. SA does not stand for St. Augustine. It stands for substance abuse, and you have no in-house program. And I know that personally because I had to send off someone to the States who was very near and dear to me because they didn't have an in-house service here. And so, yes, thankfully Salvation Army is doing some, Oasis is doing some. When I was at Sanctuary, we had to take up the slack to try to assist for young adults and young people. But the amount of money that's being spent in-house for their educational stuff, some of that should be more invested outside, either in the nonprofit agencies, or do something in-house. And as it relates to taking over, one of the first things that Governor Calvo did was fire a brilliant woman who's running a great bank as chairman of the board and impose this new board. So he does understand that under the Organic Act, this is the one area that he has absolute control of. We amended the Organic Act to take education away from him, but mental health is still his organic power that he has absolute power over.
Okay, gentlemen, thank you very much. Just one last question. Just answer one of the two. Healthcare. The Gutierrez Gubernatorial. Is healthcare a right or a privilege?
It's a right.
It's a right.
Access to health care is a right.
Okay, gentlemen, thank you very much. Appreciate you being here this morning. Thank you very much. You can watch a broadcast of this evening on local channel 2, Docomo local channel 2. Likewise, rebroadcast tomorrow afternoon as well on KUAM TV at 3:30. This will be up on our KUAM YouTube channel at about 10:30 this morning as well. Thank you very much. Tomorrow's topic will be public safety and crime tomorrow, right here on the Buzz, on the Candidate Buzz, on the For the Record. Thank you very much.